Do you struggle with knee pain? You don't need the gym to get in the best shape of your life. Let's get into how to work through that. Yes, you can work out. We'll get into some of the things that you probably shouldn't do though. First, we'll go over 6 things that you can do. The first one is to see a specialist. Personal trainers and exercise folks in the gym are not doctors or specialists. See them and see what they say first. But if they tell you to be immobile, get a second opinion, because the second thing is there is always something you can do, and you still have 3 other limbs, right? And both your knees hurt, and you're down to 2 other limbs, but you can still use those 2 other limbs. The third is think about, does it hurt? If it's a kind of or an only when it's a yes, it hurts. You may need to step back in some exercises and eliminate others, but there are a ton of exercises you can still do to stay active. The fourth thing is to use some sort of assessment. Yes, get a test done in order to assess movement quality. That'll give you an idea of when parts of your body can move well and which parts need work still. My favorite is the functional movement screen. You can look that up and see how it's done. Next, we'll go over 6 things that are contraindicated, meaning you probably shouldn't do them at the start of having knee pain. These include 1. Explosive lower body plyometric work. Number 2, heavy or explosive rotational work. Number 3, heavy knee dominant exercise. These include basically all squat variations. If your knees hurt, you can still do squats, but take it easy for a while. Number 4, explosive or high impact conditioning such as sprinting or long distance running and heavy sled work. Number 5, stretching too deep where your knee is in really high degrees of flexion, like sitting with your butt to your heels, and aggressive quad stretching. The fifth thing is to limit that mobility, though. If you can still work out, but try and be hip dominant, as they call it. Don't push the knee over the toes or the vertical tibia. Keep in mind that linear and lateral warm-ups like lateral shuffling and that sort of movement may be too much. However, walking is okay. There's also a debate on knee forward versus the vertical tibia, but your knee can definitely go over your toes or vertical tibia. Otherwise, we wouldn't be able to run, walk, or jump. 3 things I recommend to avoid the knee pain are: number 1, avoid excessive explosive work. Number 2, do your best to keep a vertical tibia. Don't push the knee past the toes. Number 3 is the most important, and that's to work with a good doctor or physical therapist. In summary, you can still do the leg work, but you may have to go slower and work your way back up, and possibly regress back to easier exercises. But remember, you can still exercise. You have multiple limbs